And is it even ever going to be possible for me to have a baby? Am I going to be a mom? Hi, I'm Sapna Ahuja. I'm a consultant gynecologist and reproductive medicine specialist at ARGC, and I've been part of the team for about 20 years. Nowadays, everybody has very set plans, like a 5-year plan. You want to achieve this job at this point, you want to achieve this salary at such a point, and of course, in all of that, you want to have a baby at a particular point. And when that doesn't happen, it can be quite frustrating. There can be feelings of lack of achievement, disappointment. And in today's world where social media is such a big thing, they've already tried all the simple means to try and get pregnant. They've tried the ovulation kits, they've done tests at home, online, and by the time they come to us, they are already in a lot of emotional turmoil. They are worried, they are anxious. Is it going to happen? What's wrong? Everybody else is getting pregnant easily. What's wrong with me? On the other hand, there are the other group of patients, couples nowadays, who are ready. They want to take action before they get to that point. They want to assess their fertility and go on, and perhaps they are in a better place, but the anxiety still prevails. Everyone has their own concerns. Sometimes it's about, I have spotting or other things where they've been through a lot already, and is it even ever going to be possible for me to have a baby? Am I going to be a mom? And you see their emotional struggle, you see their physical and financial struggle as well, and it can be quite heartbreaking. There are days I go home feeling, I wish I could do something more here. I wish I could do something to help. Sometimes it's also helping them draw a line, take a step back, look at alternative options. Because patients are so emotional about their journey, and because sometimes they're so desperate to achieve that success. So I think that's really important as a clinician to direct them, and sometimes to ask them if they have their partner, sister, family member, good friend, who would want to be present with them to talk through things with them, help them make these decisions. Lack of success in a cycle can sometimes be like a bereavement. It's very, very hard, and they need to take a step back, they need to reflect, they need to allow themselves to grieve. And in terms of the medical side of things, sometimes it's good to look back and say, can we do anything different? Is there further testing, alternative protocols we need to consider? So I think it's really important for their well-being and for the subsequent success of a cycle to help them to stop for a moment. It doesn't have to be a long break, it can be a short break. But then again, every patient is different. Some of them are very clear, this is what they want, they have a timeline and they want to do it. So you take each patient individually, but broadly, it's good to take at least a short break before moving further. I think it's very important from the outset that people have a support network, and that could be their family, it could be friends, it could be their partner. I have learned over the years that people going through the fertility journey and the challenges they experience, the highs and lows, that can mainly be understood by only other infertility patients. Those who are going through any fertility assessment, treatment, what they experience, I don't think someone else who's actually had children, not had treatment, can ever experience. I don't believe that's even possible, because what they go through, the fear, the anxiety, the eggs, the embryos, the bereavement if it doesn't work, it is a very hard journey. So having friends, family, yes, will be great, but having specialist counselors can be particularly helpful. And of course, apart from that, as we've mentioned, the team at ARGC, the support groups that you have, other patients going through that journey together. And a lot of people will see that we have a waiting room full of patients. And I've seen many a time that they become friends with each other during that journey because they're going through similar processes, the same highs and lows, and they continue to stay friends. So that's, I think, a very important part of the support structure. What I would say to someone who's really struggling is, first, approach a medical team who can look at your journey, your treatments in a realistic way and offer you honest second opinion to see what can be done, give you options that you could consider. It may be treatment, or it may be alternative treatments. It could be support in different ways. It could be to help you manage your expectations. But I would definitely say, if you're in that place, specialist counseling advice will be very helpful.